me. My name is Dr. Pamela Roach, and I lead the Brain and Mental Health Research Clinics at the Hotchkiss Brain Institute. As well, I'm also an adjunct member of faculty in the Department of Community Health Sciences, both here at the University of Calgary. I did a PhD in Medical and Human Sciences from the University of Manchester in the UK, and then a postdoctoral fellowship in Family Medicine at the University of Alberta. And I've been working with people living with dementia for over about 13 years now, really focusing on improving well-being and quality of life for people living in the community and their families. In my role with the HBI, our work is really to implement and find the best ways to use patient registries, which are clinical databases in both neuroscience and psychiatry clinics. This often includes obtaining consent to contact patients for future research. The benefit of this became really apparent in times like the current COVID-19 pandemic that we're currently experiencing. We knew that the quick switch to virtual care provision would impact the patients that are regularly seen in the research clinics. And we also knew that the patients that are usually seen in the clinics are patients who are managing a variety of chronic conditions. And they will really feel the impact of isolation and social and physical distancing on their mental, physical, and emotional well-being. Knowing this, it was really obvious to us just how important it is to understand how to provide care in a way that meets the needs of the clinic populations in a safe way, and in a way that would still encourage people to continue to access their healthcare teams despite any concerns about contracting coronavirus. With funding from the Cummings School of Medicine Rapid Response COVID Clinical Research Fund, and the ability to quickly contact people who are interested in participating in research through our registries, we were able to rapidly form a team and start interviewing people whose health is directly impacted by this pandemic. We've been interviewing people over Zoom and the telephone to understand experiences in clinics here in the cognitive neurosciences, brain injury, movement disorders, hydrocephalus, mood disorder, and epilepsy clinics. In the space of 6 weeks, we've been able to interview 119 patients in these clinics and understand that although some of the experiences can vary across clinics, for the most part, people are experiencing increased anxiety and mental health needs. And these are a result of decreased social interaction with personal contacts, less informal supports, and also worry and anxiety about contracting coronavirus while out getting essential supplies. That also includes having to leave the house more often to refill medications due to the new rules around the 30-day prescription refills. Patients are also reporting some worry about coming into clinic because the clinics are located in hospitals. And while many patients relatedly feel okay speaking to their doctor over the phone, some are anxious about using unfamiliar video conferencing technology. And patients also said that it would be helpful to be able to provide information to their doctor in advance of a virtual care appointment, just to help with that communication and treatment planning with their care team. This has allowed us to adapt how we offer appointments to patients and has allowed our physicians to quickly understand the patient's worries and needs around virtual appointments, providing the opportunity to address patient needs in real time. We're continuing the project and aiming to do repeat interviews as the pandemic continues so that we can continue to better understand changing needs over time and any cumulative effects of social and physical distancing to patient well-being and needs.